So I just decided to catch my friend Becky and then just ask all the questions that people are asking me. So if you're interested in coming to the UK to work in a nursing home or in a care home, just stay tuned and watch this video, because whatever we're going to discuss might answer some of the questions that you have. So Becky, hello guys, you're welcome to my channel. So I've got my lovely sister Becky here, who is also a fellow YouTuber, and we are registered nurses currently practicing in the UK. She's got a YouTube channel. I've also got a YouTube channel. So once in a while, because we live close by, we always meet. We are just coming from the pool. We are just coming from a pool, and through conversations, you know, something came up. So I felt like we should just do a video about it and then talk about it. Sometimes a lot of people ask me questions about how it is like to work in a care home, the contract hours, the nurse to patient ratio, the workload and everything. So I've worked in a care home before, but only as an agency nurse, and it was just about once or twice. So it's like I don't really have much details when it comes to, you know, the contract hours and everything about nursing home. So I just decided to catch my friend Becky and then just ask all the questions that people are asking me. So Becky, let's talk about the contract hours. Normally in the NHS, I know that you are contracted to work at least 37.5 hours in a week. So I don't know how it is like in the care homes. Is it the same number of hours you're expected to work per week?
So well, in the care home, everybody have their contracted hours. We all don't have the same contracted hours. So we have the part-time, which is 12 hours or 24 hours per week, and then we have the permanent, which is the 36 hours per week. We have the 42 hours per week. We have the 48 hours per week. We have the 49 hours per week.
Wow.
So it varies. So if it's 36 hours per week, you know that you're working 3 days or 3 nights per week. If it's 42, you are doing alternative 3-4 3-4.
So the number of days you work depends on the contract that you have.
Yes.
So for somebody who is coming from overseas, like how many hours per week contract do you think such a person will get?
Usually they give them higher hours.
Really?
This is because there is a trick here. The more you work for them, the more they are not going to bring agency people to pay them more money. So they are using your manpower to generate their income.
Exactly.
So usually what I advise people to do is, when you're coming from overseas, most of the times you don't have much options. But if you are here and you're looking for a care home job, always bargain for the lower contracted hours.
Oh, really?
So if it's 36 or 42 is fine. Then if you have overtime, if you are lucky and your care home gives time and a half, or they pay for enhancements for overtime, then you can use your extra hours to do the overtime to get those enhancements. Always beat for the short contracted hours, and then when you have more energy, you can do them as overtime to get those enhancements.
That's a very good point, because I didn't really know about that. So can somebody from overseas like accept a contract of 36 hours? Is it accepted?
Yes. I think that's the least for permanent employment. If you want to get sponsorship, the 36 is the least that they can give you. They can.
So this leads me then to the workload or the nurse to patient ratio. So I think the workload will depend on the number of patients that you are looking after in one particular shift, either a night shift or a day shift. So how is the workload like on a typical day? What would you be doing in a nursing home?
Right. So in a nursing home, we have patients with complex care needs, and we have some with simple care needs. We have dementia patients. So the nurse to patient ratio varies from care home to care home, but it can be anything between 1 nurse to 15 to 20 residents, or 1 nurse to even 30 residents, depending on the size and capacity. Yes,
to 30 residents.
Yes,
interesting.
Depending on the size and capacity of the home. Wow. Sometimes, it's very involving, especially if they have complex care needs, Parkinson's, diabetics. They have peg feeds. They are on oxygen. They are on catheters. It can be difficult. To be honest, once you get used to the job, you like it.
Wow, because I used to complain a lot when I was looking after between 6 to 8 patients in NHS. I was always complaining that 8 patients is just too much for 12 hours. So I don't know how I will feel, you know, working in the care home with 31 residents. Anyway, the needs of patients in NHS would definitely be different from the needs of residents in the care home. So in any way, it's still not easy anywhere.
You know, in the hospital, it's acute care setting, and their condition changes like every now and then. But in the care home, they are quite kind of stable. Yeah. Should I say? Yeah. They are quite kind of stable. Unless like emergency, once in a while you have emergency that you need to call 999. But most of the times they are stable. You know them, you know their medications.
All right.
Because sometimes you are like, somebody will be like, you are looking after 30 residents. How do you serve them medication? All the 30 of them.
How do you even start and how do you finish? Start?
Yeah. You already know these people. Okay. Their medications, sometimes a whole year, 2 years, 3 years, they are still taking the same medication. It hasn't changed. You can close your eyes and serve medication.
Okay.
Yeah.
So the workload is not as scary as people think.
No. Once they get used to you, the work becomes easier for you.
So if you start a morning medication round for like 30 residents, like how long roughly is it going to take for you to finish?
Between 1 hour 30 minutes
to
2 hours, depending on the circumstance. Depending.
So let me just share my experience in the NHS as well. So for 6 patients or 8 patients in the NHS, you realize that one person might be having endoscopy, one person might be having x-ray, the same patient might be having like 4 or 5 different IV medications. So you may think that having 8 patients in the NHS is better. Which I think is okay, but then comparing that to like stable patients in nursing homes, it's I think almost to all in all, it can be very challenging either in a care home or in a nursing home. So the workload, you cannot really say definitely that the job in a care home is more difficult than the NHS. Can't actually say that NHS is better than care home or care home workload is better than it varies.
They both have their strengths and weaknesses.
Exactly. So we'll just leave it at that for people to actually make their own informed decisions. So at least we are here to bring you the information so that you have a feel of how it is like on both sides. So regarding the career progression, yesterday somebody asked me this question. It was like, what is the meaning of career progression? Some people don't really know what it really means by career progression, either in a nursing home or in a care home. So somebody was asking me,
rising through the ranks
in the nursing profession. So for the NHS, I know that you move from band 5 to band 6, band 7, band 8. So it goes on and on. So I don't know how it is like for you to rise up in the nursing rank in the nursing home.
Okay, I think I've done a video on that. I've talked about that, and we'll leave a link, a more detailed video on that if you want to go and watch about just career progression, right? But in the care home also, we also have our career progression. So you can start as a junior nurse or a staff nurse, just like the NHS, we say band 5. Then you progress to becoming a senior staff nurse or a senior registered nurse. Then you can progress to become the clinical lead. You can progress to become the nurse in charge. You can progress to become the deputy manager. You can progress to become the manager. You are the overall, like, everybody reports to you, the manager. And then you can also do what we call the peripatetic nurse. So they are kind of like managers, but they go around from home to home to support the work in other homes.
Wow. So then peripatetic, also, can you get sponsorship for a peripatetic?
Yes, a lot of peripatetic nurses, they have sponsorship, tier 2 sponsorship for those. But if you want to be a peripatetic nurse, it's like a specialty within a care home. You need to get at least 1 year of care home experience before you can become a peripatetic nurse. And then also we have some positions, like depending on the care company you work for. Some of the care companies are very big, so they have like district managers, they have regional managers, they have national managers, they have CEOs who are all nurses.
You know, people have this mindset that when you are working in the nursing home, it's just like you being there serving medication, no way for you to even move forward. You are just stuck. That's what most people think. So from what you just told me, if you really push hard, if you work hard, you can even rise up even to the rank of like peripatetic or to whatever higher rank that you really want to get.
One thing about the UK that people do not understand is that here in UK, promotions are not automatic.
No.
So either you are in the NHS or you are in the care home, nobody will come and tell you that you are due for promotion 3 years, like back home. They'll say 3 years, you are due for nursing officer, come for it. Here is not like that. You have to apply for the position. For the first day I went to my care home, my first day at work, my manager told me to be her deputy.
So that is more like rising from
you have crossed like 4 borders already.
Really?
She just looked at me and she's like, I know you can be my deputy.
So that means if you had accepted it, it means
I would have been a deputy manager.
You would have jumped from a senior nurse
to a deputy manager.
You'd have jumped from a junior nurse to senior nurse to a deputy manager.
Yes.
Well, so that means it all depends on how you
it's
put
your
yourself
zeal
together.
and what you want to do with your life, and how serious you are, and how serious people see you.
So thank you so much for like opening our eyes on that. So now on to the most important aspect of why honestly most of us are here. The money. How is a nursing home salary like? I know for a band 5 in NHS it starts off from 25,000 per year. Exactly, that's for a band 5. That's for a band 5 in NHS. So I don't know how the salary is like in nursing home. I mean, for somebody who is starting off, you know,
okay, right,
freshly.
Let me use mine as an example. I just had my P60 form. My P60 form for the whole year. Obviously, I didn't start the whole year in the care home. I started like 3 months into the year in the care home. So my P60 form at that time that it came, which was 2 weeks ago or 1 week ago, is 46,000 per year. 46,000. Is that like for a start off? Yes.
Wow.
So like this year that I'm going to clock a proper 1 year. Next year by this time,
you'll be earning more than that.
50,000.
Wow. So is it because no? Let's start all over again. Let's start. Is it for somebody who is starting off, or for a senior nurse in a nursing home?
It's somebody who is starting off.
Really? So
yes.
46 per annum. So that's how much per month? So you divide that by 12.
You can divide that by 12, and then you do your tax calculation, your 20% tax deduction from it, and then it will tell you how much you're going to get a year.
Wow. So
one reason why the care home is rewarding is the finances. I'm here to see a care home nurse that is broke. There is no care home nurse that is broke.
Exactly.
Like by default. Once you get so I go to the care home.
So well,
you make good money.
That is from the horse's own mouth. Honestly, comparing the salary of fresh nurses in NHS to care home, the salary in care home is on the higher side. Yeah. So is it because you guys are working more than those in NHS? Is it possible that the hours you work in a week is more than the hours that NHS nurses work in a week?
The hours can count. I value care home nurses. Like, it is after I moved to the care home, I realized that care home nurses are worth whatever money they are taking.
Exactly. I think the hourly rates for nurses in care home compared to the hourly rate for nurses in NHS, there is a big difference. The hourly rate you see on your pay slip, I think in the NHS you see £13 or something. Yeah. But then I know someone who works in a nursing home, the hourly rate is £19. Comparing these hourly rates, somebody in NHS is taking £13, and someone in a nursing home is taking £19. So even if you both work the same number of hours, the salary is never going to be the same.
It's never going to be the same.
The hourly rate is higher.
Yeah, my salary was just increased, so I am paid more than the 19 I was paid before. Okay. And I'm the least paid nurse in my home. Really? Yes. Wow. So
if you do 36 hours and somebody in NHS also does the same 36, at the end of the month, the salary for the nurse in the care home is definitely going to be more. So all in all, I think the salary for nurses in nursing homes is higher compared to the NHS. That's a fact. So I mean, we've talked about the salary, the career progression, we've talked about the workload and everything, the nurse to patient ratio and all of that. So if somebody watching us from overseas want to actually start giving what we've discussed a thought and maybe consider going to a nursing home. So now how do you even go about applying? Or is there any care home that can give sponsorship from overseas to the UK?
I've done a video on that. I've talked about care homes that are giving tier 2 sponsorship, whether from overseas or if you're in the UK, because a lot of nurses in the UK want to change from NHS to the care. Go to my channel, they are the top 10 care homes that are giving tier 2 sponsorship. They are there. So if you're from overseas, obviously yes, you can apply with them, and then you can use websites like Reed, Indeed, CV Library. That is where they post these jobs. Trovate, all those things. That is where they post these jobs. So when you see them, you can apply for them, and then they get back to you. After I did that video, a lot of people have had jobs from that video. Wow, going to the care home. So that's good. You can apply with the links. There are a lot of links even in that video that you can use to apply for the jobs. Good.
So I'll leave the link to that video And I'll make sure the thumbnail of that video will be displayed so that when they go to your channel, they will know exactly what to look for. So make sure at least you've got your CV ready, you've got your cover letter, and you've got all the necessary paperwork needed. Your CV updated nicely with all the experience that you have, so that once you start and they ask you for any document, at least you've got it ready to upload for them.
Well, in a nutshell, I'll say that if you are considering care home, go for it.
How do you even work your way around to get extra money?
So I do my care home, which can give me like 3,500 per month, and then I will go and do my agency. I won't stop doing agency. I'll go to NHS and do my agency on my off days. So even if I do just 4 shifts agency per month, that also brings me money. And then I put the two together.
So you can do your own 37.5 hours in your NHS or in your care home, register with an agency whereby you'll be doing your extra shift over there.
There's oil in the land.
Exactly. That's a good way of you topping up your salary. So I think we can end this video here, and we will see you again. If there is any video that you want us to do together, please just put it in the comment section. We'll try and meet again, get all the information and bring it out to you.
So we'll just call it a video, we'll just call it a day or a night.
Yes.
Until we meet again in our next video. Guys. Is bye. Adios.